C's are great, the C's are caring.
Hi everyone, you are welcome to this week NSC 209 Physical and Health Assessment class. By the way, hope you enjoyed our last week class on topic 1, General Survey and Physical Examination Techniques. This week we will be progressing to topic 2, that is overview of health assessment. What is health assessment, by the way? Health assessment is an essential nursing function which provides foundation for quality nursing care and intervention. That is quality nursing care, the activities you perform on your patient, on individual, on a community, or somebody that is sick or well. Those activities you carried out on them, that is the intervention we are referring to here. So in this week class, we will be looking at the component, principles, and your roles and responsibilities as nurses in health assessment. Let's get to the class to start. I am Dr. Elizabeth Joseph Shehu, your facilitator, and today is 5th October 2020. Welcome to the class. We will be looking at overview of health assessment. I am Dr. Elizabeth Joseph Shehu, your facilitator, and today is October 5th, 2020. At the end of this topic, that is overview of health assessment, you will be able to define health assessment, describe the principles and components of health assessment, and finally describe your roles and responsibility as nurses in health assessment. Due to limited time, in this video I will be discussing only the concept, principles, and components of health assessment. Concept of health assessment. What do we mean by health assessment? Health assessment is a systematic method of collecting data about a client. That is not the client itself. You can collect this data from the significant others, such as the wife, the parent of the child of the client, or other healthcare provider, and this is known as secondary data. You can also collect this data from the client or the patient themselves, which is known as primary data. Systematic method in such a way that you move from one step to the other. For instance, meeting the client or the patient for the first time, you create that therapeutic environment by greeting the client warmly, and by so doing, the client or the patient will be able to relax that he or she is in a safe hand. So after pleasantry, you progress to demographic data. That is, what is your name? What is your occupation? Remember, we have not even talked about why that patient is around or why the patient comes to the clinic. So you are just asking general question. What work do you do? And after this, you now move to, from even the occupation the patient is doing, if there is anything that you think can predispose the individual to sickness, you note it down, and later you can take that up as you go along in your health assessment. In another word, all that I'm trying to say is that you move from one step to the other. And why do we need to conduct health assessment? You conduct health assessment to determine the client's current and ongoing health status. In another word, like we said during our general survey, if you did not ask the patient why you are here, what is the problem, why do you come to see us, there is no how you can know the reason why the patient comes to the hospital. So by you conducting assessment, you will be able to say, oh, this is actually the current problem this patient is having, and you can get that information during health assessment. Remember that health assessment include interview, which we will discuss in the course of our lecture today. Now, when you determine, during your health assessment, you'll be able to say, oh, this problem has been there for a while, and this one is the current one, and that is the current problem that actually brought the patient to the clinic. And also during the health assessment, you can predict activity that predispose the individual to ill health. What do I mean by that? Any activity that pose as a risk to the individual, you can take that during your health assessment. Like we will see later, that health assessment include history. During that history taking, if the individual is taking alcohol, is taking tobacco, you know that all this one can predispose this individual to ill health. It might not be now, it might be in future. Also during your health assessment, you discover that the individual have high BMI. What is the implication of that? This individual did not see the overweight or obesity as anything. The high BMI, you as a nurse know that in future this individual can be prone to cardiovascular and even cardiovascular disorder, and even diabetes mellitus. So you note that one down. And also during your health assessment, you can identify health promoting activities. Now, when you discover the risks to health, you also try to identify what are activities that the individual is actually doing that can promote the individual health, or that can make the health of this individual, either current health status or future health status, to be jeopardized. Principles of health assessment. As a nurse, when you are planning or performing health assessment on your patient, there are certain things you need to consider, certain steps you need to follow in performing health assessment. What are these steps or these points that you need to put into consideration? 1. Accurate and timely health assessment. Remember, as a nurse, health assessment form the basis for your nursing care and intervention. So without you conducting health assessment, there is no how you are going to render a quality nursing care to your client or your patient. The second one is incorporation of every aspect, all the aspects of the client into your assessment. That is, you assess the physiological aspect of the client, psychosocial aspect, spiritual health, cultural, environmental factor, and developmental status of this client. So it has to be all inclusive. You will not just say, oh no, I'm only doing physiologic, I won't do developmental status. And the third principle, that health assessment should include data collection, documentation, and evaluation of health status of your client, how your client or patient is responsive to health problems and intervention. In another word, you cannot perform health assessment without you collecting data. You cannot perform health assessment without you doing documentation. You cannot perform health assessment without you evaluating the client outcome. That is what you have done concerning your client. What is the outcome? And that is how you will know if your patient or your client is responding to your intervention. Why documentation is very compulsory in health assessment? The next point or principle we want to consider is that every of your documentation must be objective. There must be objectivity in your documentation, and in your documentation there must be accuracy, and it must be clear, concise, specific, and current. You don't document past information. In another one, when you want to document your health assessment, the vital signs you have, it should be correct, not that the one that you did last night. No, the one you are doing in this present shift should be the one to document, and that is current. And you must be specific. You must not say, oh, A or B. No, if it's A, be specific that is A. Now, also, another principle is that health assessment is practiced in all healthcare settings, all healthcare setting, irrespective of where you are working as a nurse. As far as you have contact with a patient or a client, you must practice health assessment. That is, nobody should come under you for any form of care, either curative care or preventive care. There must be health assessment. So health assessment is a component that cannot be mixed in any healthcare setting. Another principle is that every information gathered from patient or client must be communicated to other healthcare professionals. And why do we need to do this? You do this to be able to facilitate collaborative management of clients and also for continuity of care. Remember that we say you will share this information with only healthcare professional, and you have reason why you are sharing it. You share it because you want this patient to receive best of care. You don't want to hide any information from other health professionals so that it will not jeopardize the management of that patient. And the last but not the least, which is very vital, is client confidentiality. Every information you gather from this particular client, from your client or your patient, it must be in confidence. You must not share it outside the health facility, outside healthcare professionals, because reason why you are sharing it is because you want the patient to have a better management. We have 4 components of health assessment. The first one is interview, physical assessment, documentation, and finally interpretation of findings. We shall see each of these components as we progress. The first component of health assessment we are considering is the interview. In interview, a subjective data are collected, and this data can come from secondary or from primary source. And what do we mean by primary source? Primary source means that is the individual, the patient or the client, that give you the information by him or herself. While secondary source of data is that the significant other, different from the patient, somebody else giving you the report. Let's quickly look at this example. When a patient is telling you that, oh, I'm having pain on my head, I'm having pain on my legs, these are subjective data that the patient giving to you. Now, if the patient mother now said that she has been having pain, she complained of having pain, or she had been vomiting, those are secondary source of data. And all this you collect, all this information you gather or you collected during interview. And we have different type of interview. We have history, health history, and focus interview. What do we mean by health history? By the way, you look at your lesson note for detailed explanation. We just want to talk about this one briefly. What do we mean by health history? Health history are collected by the nurses from the patient or their significant other about their past medical history or present medical history. Like I stated in the earlier slide, that when you are conducting health assessment, you have to do it in a systematic way. After the pleasantry, you move to demographic data, and after demographic data, you move to past medical history and present medical history. At this point, at this point of interview is known as health history, and after the health history you move into focus interview. What do you mean by focus interview? At this point, you want to clarify issues that are not well understood by you during the period that the patient or their relative are giving you the information about the patient. For instance, you can for focus interview now, if the patient said that I'm having leg pain, now you now concentrate on that leg, and the patient did not tell you which part of the leg, when does the pain started, but you just mention it. I have been having this leg pain. Now your focus interview will now go further to say which aspect, which part of your leg is actually paining you. At this point, the patient will point at that particular point, at that particular part of the leg that is paining. Then you now ask question: is the place normally come with hotness? Will the pain normally come with hotness, or with is there any pulse, is there any wound on the site? All these are focus interview, and these are interview that you collected from your patient or your client. And we move on with example of subjective data. What are subjective data? Like we said, is what the not the nurse that see it, the patient that is telling you. Pain is specific to an individual. What I call pain is different from what you will call pain. As such, so whatever the patient tell you pain is, that is what pain is. The patient will tell you that I'm having nausea. It's not something that you see that this patient is having nausea. That is, if you can see it, that show is subjective. But in this case, it's only the patient that can tell you I'm having nausea, I'm having dizziness, oh, I feel this itching sensation. All these are subjective data. Why interview? You conduct interview as a nurse to have understanding of the client's past health status and the present health status. What is the state of health of that individual? How do you conduct an interview? For interview to be successful, it must be effective. And for you to conduct an effective interview, effective communication is key factors. So you must be able to communicate effectively, and that is the hallmark of your interview. What are other things to consider for you to achieve effective interview? Second thing is you have to create a conducive environment, a therapeutic environment, an environment that the patient will be respected, an environment that the patient will trust you as a nurse to say, yes, let me open up to this person. I'm safe in the hand of this nurse. And unless you create that environment, there is no how the patient will, you gain the trust and respect of the patient. And in most cases, I tell my students that when nurses do their work well, there's tendency for patients to see nurses and they become well. And in fact, they will just go without any cause, because your own care, you might not apply medication, but you care for the total aspect of the human being, not only the medication aspect or physiological aspect now. And most cases is the psychosocial aspect of sickness that degenerate into the physiological aspect. So if nurses can create this a climate of trust and respect, they will achieve much in delivering quality health care to humanity. Then the next thing to consider when you want to achieve effective interview is to communicate an acceptance of the client as an individual by using an open, responsive, non-judgmental approach. You have to ask your question openly. You don't have to judge the patient. In another word, you listen attentively. You maintain eye contact. You don't look as if what kind of nonsense is this patient or this client saying, especially if you are dealing with an adolescent that just come to tell you that, you know what, remember that you have your own opinion, and this young girl come to tell you that I just have a sex and I want to do abortion. I want to use post sexual intercourse medication and something like that. So as a nurse, it's your duty to render care. You don't have to judge that client, but you will listen attentively and you let the patient or the client know the implication of what he or she is doing. You do that because already you have created that climate of trust and respect. Then the next one, you communicate not only through language but also your manner of dress, gesture, and body language. So your position can push the patient away. Your position can say, please continue. The second component is physical assessment. Physical assessment is hand-on examination of the client. Is when you have contact, you touch the client to validate all the information you have gotten during your interview. Physical assessment is being conducted by professional nurse, and that is where you collect your objective data. You make use of what you see, what you feel, and what you hear. And this can only be done by the professional nurse. You are not relying now by the information or data you collect from your patient or from the patient next of kin. At this point, what you have assessed, what you have seen, what you have heard, that you are going to report on, and that is physical assessment. The third component is documentation. Documentation of data from health assessment add to an existing client health record. Client health record is a legal document that is being used to plan care and to communicate information between and among healthcare professionals and to monitor quality of care. Why health record? Why do we need health record? Health record provide information used for reimbursements of services. It also provides source of data for research, and these health records are being reviewed by accrediting agencies to determine adherence to standard. Having seen how important documentation is in nursing practice, there are some points to note when you are documenting as a nurse. Your documentation must be accurate. In another word, you must use facts. You must not abbreviate anything. Your documentation you must keep your documentation confidential. You don't share information anyhow, but like we said, you share it with other health professionals because you are sharing it for the benefit of the patient. Your documentation must be appropriate. In another word, when you have primary source data, it should be indicated. When it's secondary source of data, it should be indicated, and there should be reason why you do that. That is appropriateness, why you have to do it. Then your documentation must be complete and it must be details. It shouldn't be summarized. For instance, you cannot be saying that, okay, this patient complained of leg pain, the way the pain, no, it must be complete to say the pain is on the left lower limb toward the toes. You must describe it anatomically and it must be details. You must also use standard and accepted abbreviation, symbols, and terminology in your documentation. You will not just be writing abbreviation that is not standard. And also your documentation must reflect professional and organization standard. The last component is interpretation of finding. What do we mean by interpretation of finding? Is ability for you to make determination about all the data collected in the health assessment process. And as a nurse, you must determine if the findings fall within normal or they are above normal. Now, what are the factors that influence interpretation of finding? These factors are your ability as a nurse to obtain information, your ability to obtain the right information, your ability to recall, your ability to even apply your knowledge to the information that you've collected, your ability to communicate effectively, and also you must be able to use a holistic approach if you want to interpret your findings well. Remember, assessment must be a systematically obtained, and you have to organize it in a way that is easy for you to analyze and make a judgment about the health status of your. In conclusion, health assessment is a systematic, deliberative, and interactive process by which you, the nurses, have to use critical thinking to collect, validate, analyze, and synthesize the collected information in order to make judgment about the health status of your patient. So in today's class, we have been able to describe the concept of health assessment, focusing on definition, principles, and components of health assessment. Thank you, and see you next week for types of assessment. Bye.